Welcome to Holmes on Health, a podcast where nutrition, fitness, hormones meet health span, and science meets real life. I'm Dr. Alan Holmes, a recovering emergency physician, an expert in hormone optimization, metabolic wellness, and living life fully optimized. Each week, we dive into the tools, proofs, and evidence-based therapies to help you build a stronger body, sharper mind, and more vibrant life. Whether you're curious, confused, already optimizing, you're in the right place. Thank you for being here. Let's get into today's episode. Hello, and welcome to this episode of Holmes on Health. I'm Dr. Alan Holmes. What if I told you that there were 3 or 4 supplements that could dramatically change how you feel every single day? Not in some kind of magical, too good to be true way, but just simple supplements that there's solid, evidence-based nutritional science that back them. Today, we're going to talk about what I call the foundational supplements, the ones that should probably be in everyone's daily routine. I'm going to be talking about B12, vitamin D, creatine, and magnesium. Now, these may not sound very flashy, but they are supplements that aren't going to be forgotten next year because they've been backed by decades of research and address the deficiencies that affect millions of us. By the end of this episode, you're going to know exactly which supplements deserve a spot in your medicine cabinet or on your counter and how to use them properly. Before we jump into the specific supplements, let's address the big elephant in the room. And that's this question here. Can't we just get everything from food? The honest answer is probably not. Our grandparents, or maybe our great-grandparents, might have been able to get most of the nutrients from food. But today's reality is just different. Our soil is depleted of minerals like magnesium. We spend most of our time indoors, missing out on vitamin D synthesis provided by the sun. Then we can think about how far our food travels, thousands of miles, and they lose nutrients along the way. And let's be real, most of us aren't eating a perfectly balanced diet every single day. So that's where foundation supplements come in. It's not some biohacking gimmick, but it's filling in the genuine gaps that are just common in everyday modern life. So think of them more as insurance for your health. Now, as we've said, all that we can get from diet, we should get from diet. And it would be great if we could get all of these micronutrients from diet, but that's not the reality. So we're not suggesting that supplements replace good diet. We're saying that they can absolutely complement a good diet. In the 4 that we're covering today, they're going to address some of the most widespread deficiencies that I see in practice every day. So let's start with B12. And if you're already thinking, well, is it just vegans and vegetarians the only people that really need to take B12? Actually, B12 deficiency is quite a bit more common than that. But first, what does B12 actually do? Well, it's crucial for energy production, nerve function, and plays a role in making DNA. Without enough B12, you can't make healthy red blood cells, which means less oxygen getting to the tissues. This is what leads to fatigue and a number of other symptoms. But here's where it starts getting interesting. As we age, we produce less stomach acid, which means we absorb B12 less efficiently. So even if you are eating meat, you might still be deficient because of a poor absorption. And if you're on certain medications like metformin or proton pump inhibitors, your absorption gets even worse. Signs you might be deficient of B12. It could be chronic fatigue, it doesn't get better with sleep. It could be brain fog. It could be tingling in your hands or your feet, mood changes. All of these can be quite common, particularly if you're over the age of 50. And of course, vegetarians and vegans are at higher risk. The next thing to think about is the notion that all B12 is not created equal. There's 2 main forms out there, cyanocobalamin and methylcobalamin. Cyanocobalamin is cheaper and more stable, which is why it's the more common one seen. However, your body has to convert it to the active form, which is methylcobalamin. Methylcobalamin is already in the active form, so it's more readily available to your cells. I generally recommend methylcobalamin, especially if there is a known MTHFR gene variation. So how much should I take? Honestly, I recommend 5,000 micrograms daily. Now that might sound like a lot. The recommended daily amount is only 2.4 micrograms. But since B12 is a water-soluble vitamin, any excess is just excreted if you have healthy kidneys. And as we know and mentioned, absorption can be pretty inefficient, especially as we age. Speaking of absorption, because it's so inefficient, I recommend B12 lozenges. Or for those that are so inclined and they're not afraid of needles, B12 shots are an option. And I actually have many patients that prefer B12 shots. They just anecdotally say it makes them feel better. So good for them. Next up, vitamin D, the sunshine vitamin. Vitamin D, this one is a game changer. I call it the master hormone because it affects nearly every cell in the body. Now, most people think vitamin D is just for bone, and it is, but that's just the beginning. It's crucial for immune function, not just fighting off infections, but also preventing autoimmune reactions. It affects mood, muscle function, cardiovascular health, and even cancer prevention. And here's one more really important one. It helps lower insulin resistance. So here's the problem. Unless you live at the equator and you're spending significant time outdoors with your skin exposed, you're probably deficient. And I'm not talking severe clinical deficiency that would cause rickets. I'm talking about suboptimal levels that leave you feeling less than your best. What are the symptoms of vitamin D deficiency? Well, they're actually quite subtle, but they matter. It could be frequent infections. It could be slow wound healing, fatigue, muscle weakness, mood changes, bone and joint pain. Now, testing is important. And if you're going to test, you want to test for 25-hydroxy vitamin D. That's the blood level that you want. Most labs, like LabCorp, would say anything above 30 nanograms per milliliter is sufficient. The range goes 30 to 100. For me, I consider optimal to be in the 80 to 100 range. I've seen people feel dramatically better when they raise their levels to this optimal range. How do they do this? They take vitamin D3. You don't want D2, you want D3 because it is more effective at raising blood levels. Most people need 2,000 to 4,000 IU daily at a minimum to obtain these kind of levels. I recommend to my patients 5,000 and sometimes even 10,000 IUs a day. But testing is important to know how you're absorbing and where your levels are going. Now, you may ask, why are you so aggressive on vitamin D? And that is in part because it's really hard to get toxic on vitamin D. Well, what would toxic look like? Primarily, vitamin D toxicity means your calcium levels are going to rise. You're bringing calcium out of the bones, the blood levels rise. Now, hypercalcemia or elevated calcium levels is something we don't want. But fortunately, from vitamin D supplementation, we actually don't see it very often. One study had the patients take 40,000 units, international units of vitamin D daily, and over time, they finally got toxic with elevated calcium levels. Another study looked at patients that were on high-dose vitamin D3, tested their blood levels, had elevated calcium levels, and once they got the vitamin D levels below 300, the calcium levels normalized and the toxicity resolved. So there is significant amount of safe margin between the upper end of the lab levels, meaning 100 nanograms per milliliter, and what true toxicity levels would be. And because vitamin D just does so many good things for our body, I am for pushing the envelope on this one. So a couple other points to make. Vitamin D, because it is a fat-soluble vitamin, should be taken with some fat for optimal absorption. So you could do this by taking it with your fish oil supplement, or you could do this by taking it with a meal that contains fat. Secondly, you should consider pairing it with vitamin K. Why is this? Vitamin K2 helps direct calcium to your bones instead of to your arteries. So think of it this way. Vitamin D puts calcium into circulation. K2 tells it where to go. One last thing, if you're starting with really low levels, like well below 30 nanograms per milliliter, it can take up to 3 to 6 months of consistent supplementation to reach optimal levels of vitamin D. So be patient and don't retest immediately. Give it some time. All right, next supplement, creatine. Creatine, well, let's start here. Let's bust some myths, and then we'll get into the details. First off, myth number one, creatine is not just for bodybuilders. The second myth is that it is not going to make you bulky. The third myth is you don't need to load with it. So this is one of the most researched supplements on the planet. Over 1,000 studies supporting its benefits. I think it's probably significantly over 1,000 studies. It is one of those rare supplements where, with all the literature out there, it all sings the same song, that it is beneficial and that it is safe. Your body does make some creatine, 1 to 2 grams a day, and you get some from meat and other foods. But the studies show that supplementing with it can increase the muscle creatine stores by 20 to 40%. So most people know about the muscle benefits of creatine. It increases power, strength, muscle mass, but there's a lot of other benefits, including cognitive benefits, that are equally impressive. Your brain uses a ton of energy, and creatine helps regenerate ATP. ATP is the cellular energy currency, so that makes sense. Creatine helps produce more cellular energy. The brain needs and uses lots and lots of cellular energy. So, studies show that it can improve memory, especially under stress or sleep deprivation. It may help with depression, particularly in women. And there's even research on its neuroprotective effects for aging and neurodegenerative diseases. So, who should take creatine? Pretty much everyone, but especially if you're over the age of 40. You're a vegetarian, meaning you do not eat red meat, so losing that source of creatine. And if you're dealing with high mental demands. As we age, our natural creatine production declines, so supplementation is even more important. How much creatine should we take? Well, first off, I do not think you need to load creatine. I don't think it's beneficial, and it can certainly cause some GI digestive issues. Taking 3 to 5 grams a day is usually sufficient for most people. I would recommend 5. If you are wanting the neuroprotective benefits, the studies that really showed this robustly, the patients took 10 grams daily. So 5 grams muscle benefit, 10 grams brain benefit is how I look at it. I don't think timing matters all that much. Maybe post-workout might have a slight edge, but in general, it's about consistency over timing. You just want to remember to take it, and you want to take it every day. What type of creatine should you take? Creatine monohydrate. It's the most studied, and it's also the cheapest. There are a lot of other fancy forms out there that gurus and people will promote for better absorption or for better benefits. The one that's been most studied is creatine monohydrate. It is relatively cheap as far as supplements go, and that's the one that I recommend. Let's talk a bit about magnesium. This one deserves its own deep dive, which we're going to get into in part 2, but we'll start here with some highlights. Here's what you need to know. Magnesium is involved in over 300 enzymatic reactions in your body. It is crucial for muscle and nerve function, blood sugar control, bone health, protein synthesis, lots and lots of processes. But studies suggest that at least 60% of adults don't get enough magnesium. So why the deficiency? Sort of what we mentioned earlier. Soil depletion, food processing, and stress all contribute to the deficiency. We'll add on to that, caffeine, alcohol, and certain medications can deplete magnesium. So how do you know if you're deficient? Well, you may have muscle cramps, particularly at night. You may have poor sleep or anxiety or an irregular heartbeat. So if you have those symptoms, perhaps you do a blood level and it's low, then the next question would be, well, what type of magnesium supplement should I take? And this is where it gets a bit tricky because there are numerous different forms of magnesium. I like to think about them in 2 broad categories. The first category is poorly absorbed magnesium, and the second category is efficiently absorbed magnesium. Today, we're going to touch on the poorly absorbed. Next week, we're going to dive deep into different types of efficiently absorbed. So the poorly absorbed ones are either magnesium citrate or magnesium oxide. So poorly absorbed. And so as you might imagine, if it's poorly absorbed, meaning it might increase gut motility or bowel function. So we can use that poor absorption actually to our advantage if we are having issues with slow bowel transit or constipation. So something like 400 milligrams daily of magnesium oxide or magnesium citrate. If you are significantly constipated, we might be looking at doses of 800 or 1200 or even 2000 milligrams. Essentially, if that is the issue you're trying to solve, you're going to titrate it up to effect. Now, again, next week, we're going to dive into the different types of efficiently absorbed magnesium and all of their benefits. So there you have it. Your foundational supplement stack: B12 for energy and nerve health, vitamin D for immune function and overall health, creatine for physical and cognitive performance, and magnesium for relaxation and the hundreds of other cellular processes it's involved in. Remember, these aren't magic pills. They work best when combined with good nutrition, not to replace it. They work better if you're also continuing to regularly exercise, working on your quality of sleep, and working on your stress management. But for most people, these 4 can make a noticeable difference in how you feel day to day. The key is consistency and quality. So buy from a reputable brand that does third-party testing. Know what you're actually ingesting. Perhaps you just want to start with one of these supplements at a time to see if you notice the difference or the effects it's having on you. And for B12 and for vitamin D, you should consider testing to see where you're starting from and to see what kind of blood levels you're getting with supplementation. In part 2, we're going to dive into a bit more advanced supplements. We're going to talk about essential amino acids, colostrum, different types of magnesium that I mentioned, as well as specific probiotic strains like Akkermansia. These are for people who have the foundations covered and they're wanting to optimize even further. But truthfully, master the 4 we just talked about. They're called the foundational supplements for a reason. If you get those really dialed in, you can be amazed at the difference it can make on your day-to-day, how you feel. So thanks for listening. Until next week, please tune back in for part 2. And until then, live life optimized. Thank you for tuning into this episode of Holmes on Health. If you found today's episode valuable, share it with someone you care about. And hit subscribe so you never miss a future episode. Want to get more of our content? Follow me on Instagram and YouTube at Alan J. Holmes, MD. Until next time, here's to living life optimized. This podcast is for general informational purposes only and does not constitute the practice of medicine or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.